Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and take actions to make a better system for all of us. We're going to talk about seniors in healthcare and blood pressure today, but before we do, let me point out that down below in the YouTube description box, you'll find a link for the Healthcare Advocacy newsletter. That is the text for today's video. You can go to that link, find all of our references and background material and a lot of other healthcare references in there. And of course, you can subscribe for free. So let's get started. Standing and blood pressure. This is a cool study. A new study found that prolonged standing at work has a negative impact on participants' 24-hour blood pressure. This is a cool way to measure the stuff. This is in contrast. Spending more time sitting at work was associated with better, lower blood pressure. The study suggests that activity behavior during work hours may be more relevant to 24-hour blood pressure than recreational physical activity. Now, most of us, when we go to the doctor, we get just a single snapshot, that moment under high tension, which usually creates more blood pressure. Anyway, this is cool because they measured over an entire day. This was the Finland Retirement and Aging Study. It was conducted at the University of Turku. And of course, there's a link to their study there in the newsletter. The physical activity of municipal employees approaching retirement age was measured using thigh-worn accelerometers during work hours, leisure time, and on their days off. In addition, the research participants used a portable blood pressure monitor that automatically measured their blood pressure every 30 minutes for 24 hours. Standing too much, blood pressure goes up. So my advice, sit down. Let's talk about insured people and who can't afford health care. Yesterday, we talked about a problem that was brought forward by the National Academy of Sciences, that children need better access to health care. There's an issue that even when there is insurance available, often the copays and deductibles, their health care just suffers because people just put it off. This is a view into a study that was done by the Commonwealth Foundation. And they check who has insurance every 2 years, okay? So today we're going to talk about seniors. Now, as I mentioned, they examined who has medical insurance in the U.S. every 2 years. They analyzed, part of their study, older Americans and their ability to get health care. Now, you would think that with Medicare and Medicaid wouldn't be a problem, right? Well, here are the highlights. People age 65 and older with incomes 200% and below the federal poverty level were underinsured at the highest rate, 37%. There was no significant difference between people who had Medicare Advantage and who had traditional Medicare. Significantly, more beneficiaries in Medicare Advantage plans than in traditional Medicare reported in the survey that they could not afford their care because of co-payments and deductibles. 12% of them versus 7%. That's not good. Now, more than 1 in 5, 23% of adults 65 and older with Medicare reported that they struggle to afford their premiums that they have to pay to Medicare every month. For those with incomes under twice the poverty level, that proportion was 2 in 5, 39%. Here are some of the barriers to care. More than 1 in 5 beneficiaries, 21% of all Medicare beneficiaries reported delaying or skipping needed health care because of the cost. More than 1 in 5 beneficiaries said health care costs made it harder for them to afford food, 20%, and utility bills, 23%. 1 in 6 beneficiaries, 65 and older, 18%, reported problems paying their medical bills or death. 1 in 7 beneficiaries said they did not fill a prescription because of the cost. And there was no difference between Medicare Advantage and traditional Medicare. It was 13% and 14%. If you go to the newsletter, you'll find that there's a graph that I put in there. And what you'll see is that 38% of all Medicare enrollees, irrespective of income, have a problem getting care due to cost. And if you look at those who make 4 times the federal poverty limit or more, Medicare Advantage or traditional Medicare, doesn't matter. 1 in 5 of them, 20%, still can't get health care because of the cost. This system is broken and needs work. And what is needed is a healthcare system that ensures all of us, cradle to grave, that negotiates all drug prices and operates without the $400 billion of industry overhead, goosing profits out of the system while denying care for so many of us. Universal health care doesn't fix everything that's wrong with health care. But the problem of having insurance and not being able to use it is fixed with universal health care. Look, my member of Congress, she needs to hear about this, and so do my senators, and I bet yours do too. So let's take an action and let our senators and members of Congress know about this deplorable situation. You can call them. There's a link to their phone number or email in the YouTube description box down at the bottom. Or use your cell phone and just send a text message. Here's the message: sign, S-I-G-N, space, PWM-LML. That's PWM-LML to ResistBot at 50409 on your cell phone. Here's the message you'll send. I'm your constituent, and I just learned that 38% of Medicare beneficiaries at Medicare Advantage or traditional, both, can't get health care because of the copays and premiums. 1 in 7 can't get a prescription filled because of the copays, put them out of reach. Traditional Medicare and Medicare Advantage have the same results. Here is a link to the Commonwealth Fund report. Your staff should read it and review it. You know what fixes this? Universal health care. The $400 billion spent by the industry on overhead every year goes away the very first year we have universal health care. We can save another $200 billion every year just by negotiating all prescription drugs and getting the pharmacy benefit managers out of the way. Here's what I want you to do. Read the report. Realize that a lot of those seniors are in your district and state, and they need your help. Get in gear and start thinking about health care for all of us. Seniors, adults, teens, and children. Thank you. That's what I've got for you today. Down below, there's a button you can like and share, subscribe. You can also send me comments either through YouTube or at healthcareadvocacy1@gmail.com. I'll do your research. Have a good evening. Talk to you later.